Now, so this similar to this type 1, you can find Cori's disease are there. So you can see, so Cori disease, you can see the enzyme deficient is debranching enzyme. Clinical picture, you can see milder form of von Geiger with normal blood lactate level. Okay, LUL is not there. Lactate and lipid is also can be little bit high, but just remember LUL is not there. Uric acid is not there. Lipid is not there, and then lactic acid is absent. So lipid can be little bit high, but not as severe as this. But LU just remember for the timing, LUL is absent. Only hypoglycemia, that is also moderate. Not there is no problem with glucose maintenance. Only hepatomegaly is the prominent feature. Why hypoglycemia is not a problem here? Because gluconeogenesis is intact. There is no very severe hypoglycemia. Hypoglycemia is there, but moderate amount of hypoglycemia because gluconeogenesis will take over. So these two disorders are very similar. And this Pompe disease is completely different. What happens with Pompe? Pompe, just remember, you associate with the pump. Pompe is pump failure. Pump failure. You can remember pump failure. So heart is associated here. So in such disorder, you will see cardiomegaly. Heart is associated. And the patient dies because of heart failure. Okay. And severity of this disease is actually varies according to patient. Some patients have less severe disease, so prognosis is better. Someone will have severe disease, the prognosis is worse. Severe disease means early presentation. The presentation will be in childhood only, early childhood. Milder presentation, the presentation will be extend up to adulthood. So that way you can see. So Pompe disease involves all organs, not only heart. It involves liver and muscle, all three organs. But heart, you can associate this pump with heart. Pompe means pump failure. So this is the only glycogen storage disease here. So we have seen two categories of glycogen storage disease: mucopolysaccharidosis and sphingolipidosis. This is the glycogen storage disease of, so this is the lysosomal storage disease of glycogen storage. So Pompe disease is because of deficiency of lysosomal enzyme. Okay, it is deficiency of lysosomal enzyme. These are cytosolic enzyme. All are cytosolic. This is deficiency of lysosomal enzyme. So remember, acid maltase is there. Acid maltase is deficient. Maltase. This maltase breaks both bond, alpha 1,4 bond, alpha 1,6, both bond. So acid maltase is deficient. So you can come in your exam like this. The option can come as acid alpha 1,4 glucosidase with alpha 1,6. So both is the function of this acid maltase. This enzyme is absent. So Pompe disease is completely different. Pompe means pump failure. So you can easily remember Pompe. So two syllables are there, Pompe. So you can correlate this Pompe. So this is type 2. Two syllable in the word Pompe. So type 2 you can. Cori, C is there. C4, C is the third letter. You can, that is how you can correlate type 3 disorders. Okay. So look, that is why this is two are different. Now McArdle's disease is also completely different. M for Mac and M for muscle. So you can relate it. McArdle's is associated completely mainly with muscle. Here you can see skeletal muscle is involved, and the which is absent, which enzyme is absent. I have also told you myophosphorylase. There are two types of phosphorylase: muscle phosphorylase and hepatic phosphorylase. So here myophosphorylase is absent. So these four are very important disorders that is you can find in your first aid. And this McArdle's disease is because of deficiency of myophosphorylase. That is why the problem is associated only with muscle. There will not be any problem with the patient until the patient does exercise. You can see glycogen in muscle. Okay, so high glycogen in muscle, because glycogen in muscle cannot be degraded because the main enzyme is absent in muscle, myophosphorylase. So what will happen when a patient tries to do exercise? There will be muscle cramp, painful muscle. Okay, painful muscle cramp, and because of that muscle will break. Okay, and myoglobinuria. Rhabdomyolysis, you have already explained the terminology in lipid metabolism. Rhabdomyolysis can happen. Myoglobinuria you will see in patient because muscle cannot tolerate exercise. So there is exercise intolerance here. So you can write somewhere the terminology exercise intolerance in McArdle's disease. Here you can see fasting intolerance, here exercise intolerance. But there is one terminology, second wind phenomenon. So when a patient having McArdle's disease keep doing exercise for a longer period of time, for example, aerobic exercise, what will happen? But blood flow in the muscle will increase. And you know, if blood flow in muscle increases, that will cause what? Flow of other fuel, glucose and other like lipid also. So because of when this patient continues exercise, aerobic exercise, so after some time this patient will feel like recovery from the problem. So this is called second wind phenomenon. Okay, noted during exercise due to increased muscular blood flow. This is called second wind phenomenon. This visible in such patient. But extreme exercise, if patient goes on, this patient cannot do weight training. Very difficult for them because anaerobic exercise require glucose. Glycogenolysis is not there. So there will be arrhythmia from electrolyte abnormality, and then this muscle breakdown will be. So these are the problem. Muscular problem is associated with McArdle's disease. You can suggest this patient to do slow exercise, aerobic exercise, but not weightlifting gym. So remember this. But otherwise this McArdle's disease, the patient with McArdle's disease lives a fairly normal life. So McArdle's disease is not a problem. You can treat this patient, this disease with counseling. Cori's disease, just little bit diet manipulation like this will correct this disease because there is no big problem. Only hepatomegaly is the problem. So I will explain this Cori disease also. Here, Pompe disease is very it is lethal disease. So heart failure can happen because of heart failure and death. So this is the dangerous disorder. Okay, there are 12 different types of disorder. You can see this. So 4 disorder, if you can remember, these are high yield disorder. And you know, you can find out carbohydrate storage disorder by a stain called periodic PAS stain. Periodic acid skip stain. You will study this in pathology also. Just remember, PAS is very specific to carbohydrate. Okay. So these are the very and all the disorder here you see, these are autosomal recessive disorder. Let's go to this. So you can see the organ involvement. Why I have put this disorder so that you can see the organ involvement. You can separate the disorder based on organ. And then you can see here von Garke disease. You can see liver and kidney involvement. So main is liver. Okay. So you can see von Garke disease. You can see main is liver involvement. And Pompe all organ. Here, Cori disease, both muscle and liver. Remember, Cori, some type of Cori's disease also have muscle involvement. You can see this Cori's disease, type 3 Cori's disease, type 3A, has myopathy also, in addition to liver involvement. Cori's disease, muscle and liver, and muscle only.